We are about to start the meeting of the Governor's Council on Women and Girls, Tuesday, July 23rd. And I am delighted to welcome everybody. We are getting our Zoom folks connected. And what I'm going to do is, there's everybody. Okay, awesome. So I'm going to ask Amy Marracino, the Section Chief for Young Adult Services from DMHAS, to please go ahead and give some welcoming remarks as well.
Hi, good afternoon, everyone. Thank you so much for having me here today. It's a privilege to have the opportunity to be here and to be able to share some of the work that we are doing in DMHAS and in Young Adult Services regarding the social connection campaign and social connection opportunities that we're offering to young adults and young women in DMHAS. Thank you for having me.
Thank you so much. And now I'm going to ask Susan Hamilton, who's General Counsel and designee for my Vice Chair, Jody Hill, Lily of DCF, to give a couple of opening remarks, please.
Good afternoon, everybody. It's nice to see as many of you that could be here in person as possible. I know the summer
everybody
months are
on
difficult.
Zoom. Yeah, exactly.
Yep, nice to see you all. And again, I'm here on behalf of Commissioner Jody Hill Lilly, who deeply regrets her inability to be here today. The work of this council is really important to her, and she's been serving in attending these meetings in her prior role as well as Deputy Commissioner. So she sends her regrets, but wanted me to extend our collective appreciation to Lieutenant Governor for her leadership on the issues that the council has been addressing over elevating the issues that impact women and girls in Connecticut and really trying to coordinate effective statewide responses to some of those issues. I think our collective focus on working together to address those things across agencies and working with the communities is really unique, and we just sincerely appreciate the partnership. I look forward to hearing the presentations today, as I've actually participated on many of the prior meetings virtually, so look forward to it, and again, our thanks to all of you for the work that you're doing. Thank you.
Excellent. Thank you so much, Susan, and a warm welcome to all of our agency commissioners, directors, and designees that are joining us. So now we're going to have a couple of presentations, and we're going to start with an update on our administration's social connection campaign. And in February, the governor and I and many of our agency commissioners and advocates launched a social connection campaign. And the idea is to combat loneliness and social isolation in Connecticut. And this campaign was launched as a response to the epidemic of loneliness and isolation that the United States Surgeon General has called a public health crisis, along the same magnitude of other public health crises like tobacco addiction and gun violence and AIDS and drunk driving and obesity. This is something that the governor and I take very, very seriously. And with the governor's social connection campaign, our goal is to facilitate collaboration between state agencies and work with our federal and municipal and nonprofit and private partners and grassroots organizations because once I started talking with our agency heads, I discovered that a lot of our agencies are already very much engaged in dealing with helping folks overcome loneliness and isolation. Each of our agencies, almost all of our agencies have initiatives to do this. And really the question is, how can we get the message out there? How can we let people across the state know where to go because, of course, a lot of the programs that we have are also ones that our municipal partners run, because that's where our senior centers and our youth centers and after school programs and so much more happen. So to that end, we have presenting today Amy Marracino, who is the section chief, and she just introduced herself and said a couple of words. But Amy, we're really glad you're here. And can you please make a presentation, because I think people will be excited to learn about all that your agency is doing.
Absolutely. Thank you. Okay. So I thought I would start off by just giving just a brief overview of young adult services, just in terms, just to give folks context about the population that we serve. So our first slide, just for folks to hear the history of young adult services very briefly. So our division of DMHAS back in 1997 was given funding at a time in which the state recognized there was challenges with services for young people aging out of the DCF system of care, and they were ending up in either homeless shelters or in correctional facilities or in state hospitals. And so we were given funding at that point in time to start a program called the Special Populations Project to work with young people who had some histories of problem sexual behavior, some other individuals on the autism spectrum. And then a couple years later in 2000, DMHAS was given another additional funding from OPM to serve a population called the Transitioning Youth Project. And again, young people aging out of DCF who had needed some life skills development, substance use challenges, help transitioning to adulthood. And then we realized that there was actually more in common than not in common between these two cohorts, and we merged into what we call young adult services. And so the population that we're serving now, just we realized that those two cohorts had significant histories of trauma, significant histories of placements in highly structured treatment settings at that time. And so the folks that we've been serving now over the years come with a variety of really complex mental health challenges, which may include multiple comorbid conditions that can contribute to severe behavior problems. We do serve individuals with problem sexual behaviors. Many continue to present with complex trauma or abuse, histories of neglect, attention disorders, psychotic disorders. They may have legal involvement, and many of them have significant attachment challenges that make it difficult for them to engage in treatment. And we're also seeing an increase in comorbid substance use diagnoses with our population as well. So those are the folks that we're serving, really the most high-end, high-need, complex group of young adults in Connecticut. And so in terms of the service components of who we provide services for, so DMHAS has memorandums of agreement with DCF, as well as Carelon, as well as CSSD, and we receive those referrals directly to a team at our central office, Young Adult Services Office of the Commissioner, where we receive those referrals as early as age 16 to give us plenty of time to determine eligibility and plan to serve those individuals at the age of 18. And so we have a team of psychologists as well who help with assessments and behavioral plans for young people. And our goal is really to provide a lot of services up front and give them the support that they need so that they can really become as independent as possible and provide them with all of the resources that they need to be able to do that. And so we have a young adult services funded program in every one of the 13 DMHAS local mental health authorities, 18 sites total, that provide services to these young people. We also contract with both state private nonprofit agencies that provide different levels of residential services for young people. And we also we receive funding for a 17-bed inpatient unit on the grounds of Connecticut Valley Hospital. So both private, nonprofit agencies and state-operated services provide this intensive level of support to young adults throughout the state of Connecticut. So in terms of services that the programs offer statewide, we offer them psychiatry to help with medication management, psychotherapy, case management, clinical services that are really tailored to meet the needs of the individual clients that we're serving, nursing, significant trauma services and resources. We also use peers, partner young people with peers. That's been really helpful for them to engage with other people with lived experience that are further along in their recovery. We offer crisis services, consultation services, and assessment, and very heavy emphasis on linkage to vocational and educational services because we just know how important it is for young people to gain employment, education skills so that they can really successfully transition to adulthood. We also have a young parents program, and this serves both young women and also young men. But when a young woman becomes pregnant, we team them up with someone on our perinatal support program that's able to provide that young person with education around healthy parenting. They get those young women to all of their prenatal care appointments. They're with them through the birthing and delivery process. And then they provide services to them back in their homes to be able to really ensure that they're able to effectively parent and receive the resources that they need to parent those young people. And we also provide extensive services related to substance use and actually had developed a specialized training for all of our staff that really focuses on young people with trauma histories and harm reduction approaches to really help to mitigate substance use challenges for the young people that we serve. So this is a map of just all the services where we provide services throughout the state. So the little yellow icon shows where we have residential programs for individuals. The blue icon shows where all of our local mental health authority teams are based throughout the state that provide the clinical and vocational and other mental health services to young people. And then the inpatient unit is the purple dot in the middle of the state. And just so that we know, that folks are aware, we do provide many residential programming for young women, especially young women with trauma histories. So we do have specialty cohorts of programming that really specializes in particular populations as well. So to move on to this more specifically around social connection opportunities that we offer. So in terms of employment and education, which as I indicated is a very significant focus of our program, we collaborate with an agency called Street Smart Ventures around a program called YasBiz. And it's an entrepreneurial youth-led initiative that showcases businesses that are developed by the young adults, and they're showcased at quarterly marketplace events. And it's really wonderful because young adults can really look at particular areas or skills that they want to develop or businesses that they would like to initiate, and they are assisted with helping to develop those businesses and sell those products, and they sell those products at those marketplace events. So it's really wonderful and has offered some really great opportunities for our young adults. And then Connecticut Stay Strong grant is another grant that Young Adult Services with DMHAS was awarded in 2020, and we implemented this grant in collaboration with DCF. It's a 5-year Healthy Transition Grant, SAMHSA grant. We're currently in year 4, and really the goal of this was to help to identify, engage, and connect transition age youth and young adults ages 16 to 25 who present with or at risk for serious behavioral health disorders. And so each of the teams, we have 2 teams, one in the New Britain area, one in East Hartford, and the teams consist of an adult peer, a young adult peer, a family advocate, clinician, and also employment specialists to help to implement wraparound services to these individuals. And we've noticed between baseline and 6 months of obtaining data, young adults have reported a significant improvement in their mental health symptoms. Next slide. So another initiative that we've have been promoting is called the Young Adult Voice Initiative, and this is really to help young people. We really want to hear what they have to say. So in a time where social connection is so important, we really want to give them the opportunity to really be able to share, participating in all aspects of service delivery. We want them to know that we want to hear their input around services provided, how we provide services, in whatever way is most helpful to them. And so we do this through young adult. We had a young adult voice work group to have young adults to help us to determine the best way to do this, and to really enhance their involvement in young adult advisory boards. And we actually participated, we did a pilot where we actually had the YVAL, the youth voice at the agency level, implemented on our own staff, both at the Commissioner's Office, Young Adult Services Program, and our leadership in the programs to really assess at an agency level where we are at, so that we can really best partner and collaborate with young adults. So it was a great learning experience for all of us. And then the next slide. And this esports is actually a really great newer initiative. We've collaborated with an agency. It's called Affinity Esports, and it's a community-based organization. It's actually in the Newtown, and it was founded in 2021, and it's really wonderful in their offerings around social connection and program opportunities for young adults. And what's been really great about this program is we've had young adults who really didn't want to leave their basements or their homes or their residences in some cases, but they love gaming. And so this was an opportunity to meet with other young adults who have the same, enjoy the same activities and passions and enjoy gaming, and to get together and participate together. And what's been really great is just how many young adults ended up really showing up for these opportunities. We've expanded it across the state as more young adults have become involved, and it's just been a great way to get young people to prevent them from being so socially isolated and actually be able to be with other peers doing something that they really enjoy. So they're really learning a lot about teamwork, personal expression, and just really building up that socialization and healthy socialization to promote their mental health and well-being. And we've received lots of positive feedback from young adults about this program, and we're hoping in the future actually to look at offering additional age and developmentally appropriate exposure opportunities in areas such as graphic design and coding for young adults to really be able to expand these opportunities. And the next initiative, the turningpointct.org website, this was a website that was developed a number of years ago. It was created and developed by young adults for young adults. It offers online peer support and use of technology to strengthen young adult engagements in both mental health and substance use recovery, and really offers a variety of great resources and developmentally relevant information and social supports. And we've been partnering with Positive Directions around enhancing this website, and also received a lot of feedback. They recently did some focus groups with young adults to really get input around what's helpful on the website, what ways can the website be enhanced, as well as other opportunities for really enhancing social connection and peer support, including connection to live peer support. So that's really been a really great resource for young adults throughout the state of Connecticut. And then we also have a young adult peer warm line that we fund Advocacy Unlimited to provide, and it provides peer support to young adults throughout the state who may be dealing with various life stressors, and really are seeking connection. Some of these young people are just very lonely, and they're just really seeking connection with someone, just an opportunity to talk with someone, and to get connected to other resources in the community and supports. So the warm line is open every day from 12 to 9, and the calls are answered by certified peer support specialists, and we've included the number here on this screen as well. So I know I just provided a lot of information, so I just wanted to open it up to any questions that folks have.
Amy, thank you so much. Any questions for Amy? All right, well, I'm going to invite our agency representatives to come and sit with us in the circle, because I noticed that when we were looking at the PowerPoint, Paul and others were kind of craning. So if you would all like to join us, please come. Please come up if you would like. And any questions for Amy? Go ahead.
Oh, I'm sorry.
Susan,
Can I cut?
I'm sorry.
Oh, why don't we do the Zoom one first, and then we'll go to the in-person. Go ahead.
Okay, so Ron Welch, Department of Veterans Affairs. I'm a little familiar with the program from Easter Seal's previous employer, but I don't remember how somebody got into the program. So how does that referral go? There's probably multiple ways to enter, but I don't remember how that part of it went.
Great question. This is a referral to the Young Adult Services Program. Was that the
Yes.
ask? Yes. So thanks for asking that question. So there's two ways to be referred. So one way is if a young person is involved with either DCF, Carelon, or CSSD, the referral would get made through their respective social worker through DCF or Carelon or CSSD central office, and then those are triaged to DMHAS's central office. And we can receive those referrals as early as age 16 for planning at age 18 to serve them. And if they are not involved with any of those agencies, then close to a young person's 18th birthday, they can present at the front door of their local DMHAS mental health authority, and they can be screened that way for the Young Adult Services Program.
All right. Thank you. Susan, did you have a question?
Yeah, thank you, Amy. It wasn't really so much a question, rather more of a comment. Just we really, the partnership that DMHAS has with DCF to help transition young people who have been served by our department has really been instrumental in facilitating their success. And so we just really appreciate, I love to hear more of the expansions that have been happening over the years, but just really wanted to thank you for the presentation and for the ongoing work that you're doing to help the effort to help kids become successful when they've been engaged with our system. So thank you for that.
Absolutely. Thank you so much. The feeling is so mutual. DCF has been an incredible partner, and we're really grateful for the collaboration, and now as the expanded collaboration with CSSD and Carolina as well. So, yeah, thank you.
And I just have a question. So this age group that we're talking about is 18 to 25. So do you have any data points on how many young people you've referred to employment that have been successful, because you mentioned job readiness and that kind of thing?
Absolutely. So if I believe, if I'm kind of doing this off the top of my head, but I think we really try to get folks to be competitively employed as well. We do collect data around employment and education data, and I believe it was for the discharges about 40, I believe it was close to 50%. Actually, it was high 40s in terms of engagement in more competitive employment and other employment opportunities for young people.
Okay, because that is a resource for our employers, and so I just think one good idea would be to connect with Kelly Valeries with our governor's workforce training, so that all of those young people will have a really great place to go and be connected with not just the training but all of the support.
Yes. Thank you for that.
All right. So go ahead.
As for the new parents, how long does that support last after you leave?
That's a great question.
Okay.
We've actually had the support last even through up to maybe even age 5 for some people. So they're really able to remain involved with those young people really for as long as they need or desire that service. Yeah, it's been a great resource.
I imagine too they help with things like care for kids and that kind of thing too, because they doesn't want to go back to school.
Absolutely. They do, and they work really closely with our young adult services community teams as well. So they're connected with all those employment and education and other supports and mental health resources. So they really work together in partnership to make sure that the young adults receive the services that they need.
All right. Go ahead.
Actually, I was following up on Dailene's question as well, because through the Office of Early Child, we have a lot of services for the young children of those parents. So just was wondering, but it sounds like you've already connected with many of those. So thank you.
Thank you.
All right. This is why we have the Governor's Council on Women and Girls, because we have all the people doing the work in the same room or on Zoom. Okay, so next we have a
LG, there are a few questions in the Zoom chat.
Sure, go ahead. I'll let you take those then.
Representative Rader, I see your hand up first.
Thank you. This is really fantastic information. I just had a quick question from like the school perspective, and I know the kind of demographic is 18 to 25, but you talked about a lot about isolation, and I'm curious to know if you find that a lot of these, on the younger spectrum, the 18, 19-year-olds had a history of school avoidance or incompletion of school, not completing high school maybe. And then when you talked about the esports, I know I've been researching a lot around gaming addiction and how that kind of creates that self-isolation from, not participating and getting out of their home. But I'm more curious around, I realize that there's like a whole host of reasons why these students or these young adults land in your services, but I'm just curious around, has there been any kind of tracking of that? And do you ever find that schools are referring these students to these services?
Thank you. It's a great question. Yes, we do have quite a bit of outreach from schools, and we do try to participate at the local transition expos that schools are offering. And so it's been a really great way to connect with school systems, because they do reach out to us quite frequently around young people who are really struggling in school, and also for folks who are trying to graduate and need services post-graduation from high school. So we do get a lot of those calls and referrals from schools, and we do a lot of work in connection with schools, even on the front end around advocating for extension of IEPs where it's appropriate, because we just know a lot of these young adults really need the life skills, to be able to really successfully, graduate and then be able to move on to employment or further post-secondary education. And then with the Affinity Esports, it's been a really great resource for gaming addiction is a huge issue. And so I think one of the areas that we're really excited about is being able to focus on utilizing gaming in a positive way, and making sure that folks are really getting connected to mental health supports and resources, as well as connection with other individuals in the community. So it's really been a great resource.
Thank you. I just think it's a really smart way to get to those young adults who are isolating maybe because of gaming. It's a really smart way to actually create connection. So thank you for the information.
Okay, Marion Evans has the next question.
Thank you. Marion Evans, Southern Connecticut State University, Department of Public Health. I had several questions. Thank you for this very enlightening program, telling us about this very enlightening program, and especially the interconnections. But in order to understand the scope of this service, I might have missed it, but can you give me some general numbers about people who are taking advantage of these programs?
Sure, absolutely. So we serve about 1,500 young adults in young adult services per year. So that's just in terms of the scope for these really intensive services. So it's about 1,500 per year.
Okay, thank you.
All right, Tracy, we'll take one more because I just want to keep us on track. We usually have our meeting, so go ahead.
Sure. The last person is Jacqueline Cozen.
Hello there. Thank you so much. Just quickly, this is wonderful. I wish there were a lot more programs like this. I was wondering if there was any effort to help the young adults understand their role as a civic participant, helping them get registered to vote, and the importance of being engaged with their government. I wasn't sure if that was touched on at all in terms of the program. Thank you.
That is a great question. And yes, absolutely. It's actually part of what we've been working on too in our Young Adult Voice Initiative, just how important it is that young people are able to really share and learn how to do that in an effective way. We have had some of our young adults speak to the legislature, and we do try to really train folks in how to do that, offer them opportunities to do that, and really provide a lot of education around the best way to just to really use their voice and how important it is that we hear directly from them around what's helpful and how we're providing services. So thank you. That was a wonderful question.
All right. Well, we are going to go ahead and move on to our presentation about the Governor's Kids Cabinet. And the Governor's Kids Cabinet consists of agencies that are responsible for protecting the health, safety, and education of our most precious resource, our children. And the Kids Cabinet is much like the Council on Women and Girls, because the agencies who are part of that collaborate with one another. And we are so pleased to welcome the new chair of the Kids Cabinet, who has another hat that she wears too, which is senior advisor to Governor Lamont. She's been in our administration for several months, and she's going to present on the Kids Cabinet. Let's welcome Thea Montanez.
Thank you, Lieutenant Governor, and it's really great to be a part of today's meeting. My name is Thea Montanez, and I've recently joined the office of the Governor. Prior to my joining state service, I was at the City of Hartford for nearly 8 years, where I was Chief Operating Officer, and prior to that, it's Chief of Staff. And as part of managing day-to-day operations on behalf of the mayor, I also led several citywide initiatives focused on better supporting the needs of those persons who may be survivors of community violence, justice-involved youth and adults, and persons living with addiction, mental illness, and housing instability. And as part of that work, I was really lucky to partner with an extraordinary community of nonprofit partners and advocates, and our state's attorney, Charmise Walcott, who is here. She and I worked to support ROCA, which is a nonprofit located here in Hartford that is supporting young women, young mothers.
I visited. It's really awesome.
Yes.
It's great.
Yeah, ROCA has been a critical partner in supporting young women, specifically survivors of human trafficking. And so I know that State's Attorney Wolcott sits on their board of directors, and we're so grateful for her leadership. So those experiences have very much informed my work here at the state. A big focus of my work is to lead interagency initiatives that are solution-focused and that are primarily designed to provide better access to resources that we have to offer Connecticut residents, as well as to develop public-private partnerships that are in support of that same goal. So as the Lieutenant Governor mentioned, last fall the Governor established the Kids Cabinet. It was under the leadership of our former DCF Commissioner, Vanessa Durantes, who has since then left. But she did convene that group in October and then again in December, and I recently reconvened them just 2 weeks ago to kind of hit a reset and figure out what our priorities are moving forward, and that is what I plan to share with this group today. Next slide, please. So the mission and key principles. This group is focused on planning and implementing solution-focused interagency initiatives designed to improve the lives of Connecticut's children, youth, and I don't think we can do that without also supporting their families. So there are three key principles that guide our work together. One, promoting equitable policies to ensure all of Connecticut children, their safety and well-being, as well as reducing racial and socioeconomic disparities. The second is creating comprehensive and integrated systems of care by strengthening communication and partnerships across the child well-being system. And the third is making better use of our existing resources by coordinating our interagency services and pursuing funding opportunities. Next slide, please. This is the current membership of the Kids Cabinet. There are 11 agencies or offices that are represented, primarily those that are health and human service related, but we also understand the important role that education, housing, and our Office of Policy and Management plays in this work, and so they've been invited to join us as well. Next slide, please. So I thought it made sense to share this information that was recently released by the Annie Casey Foundation. They, every year for the past 31 years, produce what's referred to as the Kids Count Data Book. And so it presents national and state data from 16 indicators in four domains, and it ranks the states according to how children are faring overall. So you will see that the state of Connecticut overall specific to child well-being ranks number 8, and the four domains are economic well-being, education, health, family, and community. I am very proud that we are number 1 in the country regarding preschool attendance. We are number 3 in the country regarding the number of children with health insurance. And as you know, in recent years, we've made significant increases in education and early learning. And there's also a lot of opportunity for us to think about how to reduce the housing cost burden that is also affecting children and families, and again, addressing racial and socioeconomic disparities, especially in our education and criminal justice systems. So there are many priorities that this group could focus on, and I'm going to share 3. But please do, this is not to suggest that we are not also considering other issues that are just as important, but these 3 were the 3 that we discussed at this particular meeting. The first is the issue of homeless children and youth. And so this information here is available online. The State Department of Education has their EdSite portal. And so this data here I received from SDE. So when we're looking at 22-23 school year, there's about 5,100 homeless pre-K through 12 students. That represents 1% of our student population in the state of Connecticut public schools. And you will see 82% of them are students of color. 27.5% are students with disabilities, and 22.2% are English learners. I do want to note that Commissioner Mascara-Bruno from our Department of Housing is currently partnering with our Office of Early Childhood to house homeless children and families that are participating in Head Start. Her department also prioritizes children and families, homeless children and families within their Section 8 voucher program. And she also leads our Interagency Council on Homelessness that was convened, I believe, in 2024. And she is actively working on a strategic plan to address the issue of homelessness. So she and I are working together, specifically focusing on homeless children and youth. Next slide, please. This information that I'm sharing here just talks about who is represented within that number of 51 homeless children and youth, and you'll see that 3,300 of them are doubled up, meaning that they are living with other persons. So they could, potentially be couch surfing, living with friends and family, but we are including those children and families in these numbers. Sometimes those folks that are under those circumstances are not included, but SD has included them in these numbers. About 1,100 are living in a hotel motel. 630 of them are sheltered, meaning living in homeless shelters or emergency shelters, and about 98 are unsheltered. And so the good news is that we do have existing resources within DCF and DOH, and there very well may be additional resources in other agencies. And again, they represent 1% of our student population. So it should, I'm hopeful, I remain optimistic that we'll be able to house those young people.
Yes, we have over 500,000 students in our public schools across Connecticut. So we have a significant homeless youth issue.
The second group of young people that we have prioritized, just the slide before, are referred to as crossover youth. And so those are youth who are at risk or are fluctuating between our child welfare and our juvenile justice systems. We do not have a concrete number in terms of how many youth meet that definition. In working with DCF, they are trying to work towards being able to confirm that number, but we know currently they're unable to do so because it would involve sharing and receiving information from other state agencies, and they may not have the technology, the data sharing agreements, or even the legislative authority to be able to do that. So they're trying to develop, they are actually developing interim solutions for trying to figure out what that number is, but I certainly am working with the commissioner and her team to figure out how we put systems in place so that we have a better solution for that, so we're able to easily identify who those young people are and figure out what is the best way to support their needs. And then the third group, you may have heard a bit about in the past year, mostly because in 2023, the Boston Consulting Group released a study that was commissioned by Dalio Education, and it revealed 1 in 5 of Connecticut's young people were either at risk or disconnected. So there's approximately 119,000 young people who have either dropped out of school or are in danger of dropping out of school, or who are between the ages of 18 to 26 and are unemployed in many cases, or unemployable. And so since this information has been released, there was a commission that the Connecticut Conference of Municipalities put together, mostly of elected officials. Since March, they have been hosting various town halls throughout the state of Connecticut, focusing on this particular group of young people and receiving comments and hearing from community members about the ways in which they think we should be supporting the needs of these young people. In fact, tonight at Hartford City Hall at 5:30, the commission is having a town hall focused on alternative education. So
Thea, can I
yes.
just ask, of
Sure.
the 119,000 young people, which is a shockingly huge number when you consider that there are 500,000 young people who are in public schools right now. Of the 119,000, how many young people are, up to 18 in that group, right? Because this also refers to young people who are already out of high school or have
Sure.
dropped out. So I was curious, how many of the 119 are still in school?
I believe that number is 63,000, but I will need to confirm that.
Got it.
And so the
about
commission-
half-ish.
Yes. Yeah,
Okay.
that's right. And I believe the commission has focused initially on those 63,000. And so they are preparing to produce a report with all of the information they've gathered since they've hosted these town halls, and they're planning to submit their recommendations this fall.
Because we know where those young people are, and we can help them because they're right in front of us.
That's right.
The other ones are harder to find.
Yep, that's absolutely right. So those are the 3 priorities we've identified. And so the next slide just speaks to our approach in trying to support the needs of these young people. And this very much is informed from my experience as a former chief operating officer. The idea was, how do we create a process that we can apply to each priority issue, and one that we can operationalize, right? So what is the highest and best use of our commissioners, but also recognizing that these issues are complicated and we're going to need to spend more time than meeting for 60 or 90 minutes every quarter, that we're going to have to also have additional staff members within the agencies commit to meeting on a more regular basis and really getting into the weeds, if you will, and understanding the mechanics of how their agencies are trying to respond to these issues. So the first you'll see is the cabinet itself, and so establishing goals, approving an interagency implementation plan, committing agency resources, as well as recommending system improvements. So the idea is, if we focus on an issue, what will it unearth in terms of system strengths and deficiencies that could potentially inform legislative changes? The second is each agency will be required to do a programmatic evaluation. So the first is confirming what their regulatory authority is. The second is collecting, analyzing, and sharing relevant data. And the third is identifying what agency resources they can bring to the table, whether that's programmatic initiatives, funding sources, and community partnerships. And once each agency's done that homework, if you will, they will join the third group here, which is an interagency planning and implementation team. And this team is charged with developing and executing an approved operational plan. They are monitoring our progress and tweaking accordingly, and then they're reporting out on outcomes back to the cabinet. So it's almost a rinse and repeat kind of approach, and I'm hoping that, again, we'll first start taking this approach with our homeless youth and then move on to our crossover young people and our opportunity youth. And at this time, I am happy to answer any questions or hear feedback from those in attendance today. Thank you.
All right. Any questions in the room or on Zoom? All right. We'll start with you, and if you would just identify yourself, and then Tracy, you'll let us know about the Zoom folks. Go ahead.
Sure. So I cannot speak on behalf of the task force, but I will say a couple of things. One is that the numbers that are reflected that SDE is reporting out is based on information they've received from districts as per McKinney-Vento. And so I do believe SDE has indicated those numbers may also reflect those students who may be undocumented who have been identified as being homeless. I will say my experience in Hartford is we certainly experience persons coming in, people that may be undocumented, and they were coming in quietly, if you will. So I think where you see other cities like New York and DC, where there are literally maybe busloads of people that are being, transported to the state or to, those communities, we are not experiencing that. But that doesn't mean they're not here. And so they are quietly coming, they are staying with family and friends, and in some cases they do end up homeless. And that is when we become aware of their arrival. I certainly have heard of some communities, larger urban communities, where they are seeing an influx of folks that are undocumented, but that is certainly something we've discussed with SDE so that we are taking their needs into consideration as well. You're welcome.
All right. Do we have any questions on Zoom, Tracy? All right. Yes, go ahead, please.
Thanks. I was just curious about the age group. It's an overwhelming number of homeless children, and I'm just curious if you have it broken down by ages. Do you have any statistics on that?
SD does have the information available online, and it's pre-K through 12. However, I believe those are pre-K programs administered through the school system, and there are pre-K programs that are not necessarily being administered by school systems. They could be done through early learning centers that are outside of the school districts. So I don't believe that number that is reflective is inclusive of all of our pre-K providers. You're welcome.
Great. Any other questions for Thea? We thank you so much for that presentation. And actually, it is a great segue into a discussion we're going to have very shortly about ideas for legislation that the council would like to submit. So first, but before we do that, I do want to turn to the council leadership report just to give you an update. So we announced at our last meeting, and all of you now should have received an email from my former general counsel, Christine Jean-Louis, who is now sitting as a judge on our Superior Court, on the completion of the annual summaries for 2019, 2020, 2021, 22, and 2023 CoWaG meeting years. And there are links to all of those documents, and the reports are on our CoWaG website. And the annual report summaries are meant to help members and designees of the council who would like to learn more about the work that we do and what we've accomplished and what is still out there to do. And I mentioned at the last meeting that we thought these annual summaries would be very helpful to review as you are doing your subcommittee work for the council and are thinking about your 2024 or your 2025 agenda. We are in our 6th year, and we're asking our subcommittees, if they haven't already done this, to revisit the description of your subcommittee and revise them and take a look at your mission and see if you would like to change that description since it was first created. So any question about that? The other thing, since I mentioned our other general counsel who is now on the Superior Court, I want to introduce, if you have not met her, Tracy Apuku, who has joined us from the United States Attorney's Office, and she is here helping us coordinate the work of the Governor's Council on Women and Girls and continuing the great work that we do at CoWaG. So if you need anything, have any questions, have any ideas for future presentations, she is the person. All right, so now we're going to jump into subcommittee reports and updates. If any of our subcommittee chairs would like to share. Do we see anybody on Zoom, Tracy? And anybody have anything here? All right, I do not see that. So, very good. Any announcements?
Lieutenant Governor, I was trying to raise my hand, but I
Oh,
ended
sorry,
up with the thumbs
Shantae,
up.
we would never, ever forget about you, please.
Thank you. I think this is perfect timing given the presentation we just received. I just want to give an update on Head Start on housing. So the majority of our families are single parent homes with the children living with their moms. 239 families have been referred to Head Start on housing from our Head Start and Early Head Start partners statewide. We have housed 102 families to date, 223 children. Now, of those children, 166 are Head Start and Early Head Start age from 0 to 6, and 59 are McKinney-Vento age, K through 12. We are currently looking at apartment searching, leasing up 45 families, and 50 applicants are in review. So we will surpass our initial goal of the program of 150 families. You can log on to our website, headstartonhousingct.com, to look at our dashboard, because I know I have to quickly go through those numbers, but we update that dashboard weekly. And the demographics part of it is live. So as applications are uploaded, that information is to the minute, to the moment. So both the data I just shared, as well as demographics, ethnic background, what have you, is also on our dashboard. It's also important to note that 25 of the families that were referred were high risk, living on the street or in cars. 53 of the families were living in shelter, and the remaining were doubled up or couch surfing. So again, we have surpassed what we initially thought the program that what we were going to do from where we started in the pilot form 2 years ago. So we're really excited. And as was shared earlier, Commissioner Mascaro Bruno is leading this initiative to house children from early Head Start to Head Start, as well as K through 12. We've been able to feed two birds with one seed with our program because many of our Head Start and early Head Start children have siblings, but we also are working with SDE and the respective boards of education with their McKinney-Vento liaisons, because we also want to support the children K through 12 that do not have siblings that are in early childhood programs.
All right.
So that's my update. Any questions or comments?
Okay. Do we have another? Do we have any questions or comments for Shantae? Well, thank you for sharing that, Shantae. Appreciate it.
Thank you.
Tracy, do we have any other Zoom? Okay. So at this point, I'm going to talk about how you would go ahead and submit ideas for the upcoming legislative session. So I'm going to ask that each of our subcommittee leadership request that proposals be submitted in advance of their August and September meetings using the updated OPM form. So you can get one of those from Tracy Abuku if you haven't already gotten one from her. Subcommittee co-chairs should review the submissions and, if scheduling allows, discuss those that have been submitted and decide which you would like to advance. And once the co-chairs have agreed on any proposals, you can send those to me or to Vice Chair Commissioner Jody Hill-Lilly through my general counsel in advance of the full council meeting that we have on October 15th. And the reason we're asking for the proposal so early is we are going into a long legislative session. So that begins in January, and we will share some of these proposals that we get with the governor. We've had a bunch of proposals that have come through our Council on Women and Girls that have come to fruition. For instance, banning child marriage was one. Also providing that our public financing dollars can go to child care in the case of either men or women candidates who need that as they are running for office. So those are just some of the examples. So please, in your subcommittee, think about and solicit proposals from your members, and then forward those on, should you decide to do that, to Tracy, Jody Hill, Lily, and I. Between October and January, we're going to be reviewing those, and we are going to send ones that we approve for review in the governor's office. So co-chairs, please distribute your legislative proposal forms. We got some really great proposals in the past, and we'll look forward to any that you think we ought to entertain. So with that, any questions on the legislative proposals? All right, so I'm going to share with you the rest of the meeting dates for the council for 2024. We have a meeting next scheduled of the full council on October 15th, 2024 at 3 p.m. And our subcommittee meeting dates are going to be for economic opportunity and workforce equity. We have August 13th at 3. Education and STEAM is scheduled to meet August 21st at 3. Leadership is scheduled to meet on September 18th at 3. And health and safety is scheduled to meet on September 23rd at 10 a.m. And by our October meeting, we will circulate the 2025 calendar for the council and the subcommittee meetings. So make sure you get all of those dates on your calendars. So any other announcements, Tracy, that we're seeing in the chat?
Just one from Dr. Shante Hanks, who says that Housing Community Development Leadership Institute is accepting applications for the next cohort. The website's in the Zoom chat at www.hcdli.org.
Fabulous. Any other announcements? All right. Well, we thank you all for coming, and as we always strive to do, we try to keep our meetings to an hour, so we started on time and we are ending on time, and this is why women should be ruling at every level. So and men of taste and discernment, we appreciate you too.
He agreed. He agreed.